So of late, I've been reading some books to my niece, Abby, and to my grandson, Billy. And I was looking on my shelves for something else to read, and I came across this. Extraordinary Healers. And in this book is a story about my sister. So I thought I would read it to you. The Right Nurse Rocks. Laura Gilliam, RN, BSN. And at that time, she was a nurse at Wake Forest University Baptist Medical Center in Winston-Salem, North Carolina. And this was written by Susan Harris, who was one of her patients. I was diagnosed with liposarcoma in June 2003. I was fortunate enough to have successful surgery at Wake Forest. After 3 years, the cancer returned. This time, it presented in my abdomen, the original site, and in multiple tumors in my left lung. At this point, it was inoperable, and chemo was my only option for survival. Because my type of cancer is stubborn, chemo usually doesn't work. I was placed on a trial chemo at Wake Forest, and there I met Laura. Experiencing cancer at a large university hospital is a little like being a rock star. If you do well, then you walk off the stage content that your performance was good. If you don't, you walk off the stage knowing it may be your last performance. However, at Wake Forest, you could feel the excitement of the fans. If you stumbled off the stage, hundreds of hands would lift you up and pass you back to your safety net. Laura proved to be the best stage manager a rock star could ever have. Let me back up. When in a trial chemo program, you are assigned a coordinator. This nurse manages your blood work and appropriate tests and documents the results. Laura easily and efficiently managed my case and other patients' cases that were assigned to her. Where most nurses end, however, there is magic of Laura that begins. As any good stage manager knows, the best way to get a good performance out of your star is to make her feel unique and comfortable. Laura approached my needs in a holistic way. She shared jokes, included my loved ones, and even helped me find a place in Winston-Salem before my treatments. She made sure the show went on. I took the trial chemo for nearly 9 months. Laura was always there to keep her star pumped for the show. As an avocation, Laura is a screenwriter. Because we were about the same age, she shared her latest script with me, which was Growing Up in the 1970s. The stories always lifted me up and took me back to a simpler time in my life. When you are sick, there is an aching need to escape the abnormal way of living. It wasn't chocolate-covered cherries or fine cigars that I demanded backstage. It was this taste of normal that made it easier to perform. A good stage manager sacrifices. Usually no one else knows how hard it is to pull off a successful show and how many behind-the-scenes hours are needed. In December 2007, my trial chemo failed. In fact, my situation became worse, and the oncologist decided to try one more standard chemo. Laura was there for me that day. She talked me through the change and helped me arrange a transition to chemo in my hometown. She was there from the minute I got the news until I drove my little car back up the mountain to Asheville. She hugged me and told me everything was going to be okay. Although she was no longer my coordinator, she offered to help with anything that would make my job easier. As we left, my partner overheard the other nurses talking. What was Laura doing here today? I thought she was on vacation. Laura came in her own time so that hopefully my time would be easier. Since my time in chemo, I've had 2 more surgeries. Laura is no longer my stage manager, but she has become my friend. She did her best to help me do my best. Words can barely express how important she was to my success. As I start my clock on living a cancer-free life, I will always have the greatest gratitude for the many hands that lifted me at Wake Forest, knowing that each one represents a caring professional who made the unbearable bearable. And I think right now, I worry a lot because Laura is a traveling nurse, and she's had some patients who I'm sure she's concerned whether or not she's going to also get this virus. And I worry about her. I know she's taking all precautions that she needs to, but I think that it speaks a lot to all of the healthcare professionals out there right now. Be safe. God bless.